Have you ever been jolted awake in the middle of the night by a sudden, painful cramp in your leg? Nighttime leg cramps are a common problem that can disrupt sleep and leave you feeling sore the next day. While there are many possible causes, research shows that certain vitamins and minerals play a significant role in muscle health and cramp prevention. In this video, we'll explore which nutrients are most closely linked to leg cramps at night, why they matter, and how you can test your levels safely. Let's start by understanding what exactly happens during a leg cramp and why it's so common at night. Leg cramps are sudden, involuntary muscle contractions that most often affect the calf muscles. These cramps can last from a few seconds to several minutes and are particularly common at night. The pain can be intense, sometimes leaving the muscle sore for hours afterward. While anyone can experience leg cramps, they are more frequent in older adults, pregnant women, and athletes. Understanding the underlying causes is key to finding effective relief and preventing future episodes. Next, let's look at the most common triggers for nighttime leg cramps. Nighttime leg cramps can be triggered by a variety of factors. Dehydration, prolonged sitting or standing, and overuse of muscles are common culprits. However, one of the most overlooked causes is an imbalance in essential vitamins and minerals. These nutrients are vital for proper muscle function, and even a slight deficiency can increase the risk of cramps. In the next scenes, we'll focus on the specific vitamins and minerals most closely linked to leg cramps, starting with magnesium. Magnesium is a crucial mineral that helps regulate muscle and nerve function. It plays a key role in muscle relaxation, and low magnesium levels are strongly associated with increased muscle cramps, especially at night. People who don't get enough magnesium from their diet, or who lose magnesium through sweat or certain medications, may be more prone to cramps. Foods rich in magnesium include leafy green vegetables, nuts, seeds, and whole grains. Next, we'll discuss how to safely test your magnesium levels and what symptoms might suggest a deficiency. If you suspect a magnesium deficiency, it's important to test your levels safely. Blood tests can measure magnesium, but because most magnesium is stored in tissues, blood levels may not always reflect true body stores. Your doctor may recommend a red blood cell magnesium test for a more accurate assessment. Symptoms of deficiency include muscle cramps, fatigue, and irregular heartbeat. Never start supplements without consulting a healthcare professional, as too much magnesium can cause side effects. Next, let's explore another key mineral, potassium. Potassium is another essential mineral that helps transmit nerve signals and contract muscles. Low potassium levels, known as hypokalemia, can lead to muscle weakness, fatigue, and cramps. Potassium is found in many fruits and vegetables, especially bananas, oranges, potatoes, and spinach. Maintaining a balanced intake is important, as both too little and too much potassium can be harmful. In the next scene, we'll look at how to check your potassium status and what signs to watch for. Testing your potassium levels is straightforward and usually involves a simple blood test. Symptoms of low potassium include muscle cramps, weakness, and sometimes irregular heart rhythms. It's important not to self-diagnose or self-treat potassium imbalances, as improper supplementation can be dangerous. Always consult your healthcare provider before making any changes to your diet or taking supplements. Next, let's turn our attention to calcium, another mineral vital for muscle health. Calcium is best known for its role in bone health, but it's also essential for muscle contraction. Low calcium levels can cause muscle spasms and cramps, particularly at night. Dairy products, leafy greens, and fortified foods are good sources of calcium. Certain medical conditions and medications can affect calcium absorption, increasing the risk of deficiency. In the next scene, we'll discuss how to test your calcium levels and the importance of maintaining balance with other minerals. Calcium levels can be checked with a standard blood test. Symptoms of low calcium include muscle cramps, tingling in the fingers, and even changes in mood. It's important to maintain a balance between calcium, magnesium, and vitamin D, as these nutrients work together for optimal muscle and bone health. If you're concerned about your calcium status, speak with your healthcare provider before starting supplements. Next, we'll introduce vitamin D and its connection to muscle function. Vitamin D is crucial for calcium absorption and overall muscle function. Deficiency in vitamin D has been linked to muscle weakness and an increased risk of cramps, especially in older adults. Sunlight is a natural source of vitamin D, but it can also be obtained from fortified foods and supplements. People with limited sun exposure or certain medical conditions may be at higher risk for deficiency. In the next scene, we'll discuss how to test your vitamin D levels and why safe supplementation is important. Vitamin D levels are measured with a blood test called 2,5-hydroxyvitamin D. Symptoms of deficiency include muscle cramps, bone pain, and fatigue. It's important to avoid excessive supplementation, as too much vitamin D can cause toxicity. Your healthcare provider can help determine the right dosage if supplementation is needed. Next, let's briefly touch on sodium and its role in muscle cramps. Sodium is an electrolyte that helps maintain fluid balance and supports nerve and muscle function. While low sodium is less commonly linked to nighttime leg cramps, it can be a factor, especially in people who sweat heavily or use diuretics. Symptoms of low sodium include muscle cramps, headache, and confusion. It's important not to overconsume sodium, as high intake is linked to other health risks. Next, we'll summarize the key vitamins and minerals involved in leg cramps. To sum up, the vitamins and minerals most closely linked to nighttime leg cramps are magnesium, potassium, calcium, vitamin D, and, to a lesser extent, sodium. Each plays a unique role in muscle health, and deficiencies can increase the risk of cramps. Testing your nutrient levels safely with the help of a healthcare provider is the best way to identify and address any imbalances. In the next scenes, we'll discuss how to approach testing and supplementation safely. When it comes to testing for vitamin and mineral deficiencies, it's important to use reliable methods. Blood tests are the standard for most nutrients, but some, like magnesium, may require more specific testing. Always work with a healthcare provider to interpret results and decide on next steps. Self-diagnosing or self-treating can be risky, as both deficiencies and excesses can cause health problems. Next, let's look at the risks of oversupplementation and why moderation matters. While it's tempting to take supplements to prevent leg cramps, too much of certain vitamins and minerals can be harmful. Excess magnesium can cause diarrhea and heart problems, while too much potassium can affect heart rhythm. High calcium intake may lead to kidney stones, and vitamin D toxicity can cause serious health issues. Always follow recommended dosages and consult your doctor before starting any new supplement. Next, we'll discuss lifestyle changes that can help prevent leg cramps naturally. In addition to managing your vitamin and mineral intake, certain lifestyle habits can help reduce the frequency of nighttime leg cramps. Staying hydrated, stretching before bed, and maintaining a balanced diet rich in fruits, vegetables, and whole grains are all beneficial. Regular physical activity and avoiding prolonged sitting or standing can also make a difference. Next, we'll look at specific foods that support muscle health and may help prevent cramps. Certain foods are especially helpful for supporting muscle health and preventing cramps. Bananas, avocados, spinach, yogurt, and almonds are rich in magnesium and potassium. Dairy products and fortified plant milks provide calcium and vitamin D. Including a variety of these foods in your daily diet can help ensure you get the nutrients your muscles need. Next, we'll discuss when to seek medical advice for leg cramps. Most nighttime leg cramps are harmless, but if you experience frequent, severe, or persistent cramps, it's important to consult a healthcare provider. Cramps that are accompanied by muscle weakness, swelling, or changes in sensation may indicate an underlying medical condition that needs attention. Your doctor can help identify the cause and recommend appropriate treatment. Next, we'll review some common medical conditions linked to leg cramps. Several medical conditions can increase the risk of nighttime leg cramps. These include diabetes, kidney disease, thyroid disorders, and nerve problems. Certain medications, such as diuretics and statins, can also contribute to cramps by affecting electrolyte balance. If you have a chronic health condition or take medications regularly, discuss your symptoms with your doctor to rule out any underlying issues. Next, let's talk about the importance of a personalized approach to cramp prevention. Preventing nighttime leg cramps often requires a personalized approach. What works for one person may not work for another, depending on individual health status, diet, and lifestyle. Working with a healthcare provider to assess your unique risk factors and nutrient needs is the best way to develop an effective prevention plan. Next, we'll discuss the role of hydration in muscle health and cramp prevention. Proper hydration is essential for muscle function and can help prevent cramps. Dehydration can lead to an imbalance of electrolytes, increasing the risk of muscle spasms. Drinking enough water throughout the day, especially before and after exercise, is important. If you sweat heavily or exercise intensely, consider replenishing electrolytes with sports drinks or electrolyte-rich foods. Next, we'll look at the impact of exercise on leg cramps. Exercise can both trigger and prevent leg cramps. Overuse of muscles during intense activity may lead to cramps, especially if you're not properly warmed up or hydrated. On the other hand, regular, moderate exercise helps keep muscles strong and flexible, reducing the risk of cramps. Stretching before and after physical activity is especially helpful. Next, we'll discuss the importance of stretching routines for cramp prevention. Incorporating stretching routines into your daily schedule can significantly reduce the frequency of nighttime leg cramps. Focus on gentle stretches for the calves, hamstrings, and feet before bed. Hold each stretch for 20 to 30 seconds and avoid bouncing. Consistency is key. Regular stretching helps maintain muscle flexibility and reduces cramp risk over time. Next, we'll look at how sleep position and bedding can influence leg cramps. Your sleep position and bedding can affect your risk of nighttime leg cramps. Sleeping with your legs in an awkward or cramped position may trigger muscle spasms. Try to keep your legs relaxed and avoid tucking your feet tightly under blankets. Using supportive pillows or adjusting your mattress can also help. Next, we'll discuss the role of footwear and daily habits in cramp prevention. Wearing supportive footwear during the day can help prevent muscle fatigue and reduce the risk of cramps at night. Avoid high heels or shoes with poor arch support, as these can strain your leg muscles. Taking breaks to stretch and move throughout the day is also beneficial. Next, we'll look at how certain medications can influence your risk of leg cramps. Certain medications, such as diuretics, statins, and some blood pressure drugs, can increase the risk of leg cramps by affecting electrolyte balance. If you notice cramps after starting a new medication, talk to your doctor. Never stop or change your medication without medical advice. Your doctor can help adjust your treatment or recommend ways to manage cramps. Next, we'll discuss the importance of regular checkups for ongoing cramp prevention. Regular medical checkups are important for monitoring your overall health and preventing leg cramps. Your doctor can assess your risk factors, review your medications, and recommend appropriate tests for vitamin and mineral deficiencies. Early detection and intervention can help prevent more serious problems down the line. Next, we'll summarize the key takeaways from this video. Nighttime leg cramps are often linked to deficiencies in magnesium, potassium, calcium, and vitamin D. Safe testing and working with a healthcare provider are essential for identifying and correcting imbalances. Lifestyle changes, such as staying hydrated, stretching, and eating a balanced diet, can also help prevent cramps. Remember, supplements should only be used under medical supervision. Next, we'll answer some frequently asked questions about leg cramps and nutrition. Supplements can help prevent leg cramps if you have a documented deficiency, but they are not a cure-all. Taking unnecessary supplements can be harmful. It's best to get most of your vitamins and minerals from a balanced diet and only use supplements under the guidance of a healthcare provider. Next, we'll address whether certain people are at higher risk for leg cramps. Older adults, pregnant women, athletes, and people with chronic illnesses are at higher risk for nighttime leg cramps. These groups may have increased nutrient needs or be more prone to imbalances. If you fall into one of these categories and experience frequent cramps, talk to your healthcare provider about testing and prevention strategies. Next, we'll discuss whether leg cramps can be a sign of a serious health problem. Most leg cramps are harmless and can be managed with lifestyle changes and proper nutrition. However, if cramps are severe, frequent, or accompanied by other symptoms like swelling or numbness, they may signal an underlying health issue. Always seek medical advice if you're concerned. Next, we'll look at the role of hydration in more detail. Staying hydrated is key to preventing leg cramps, but how much water do you really need? Most adults should aim for at least 8 cups of water a day, but needs vary based on activity level, climate, and individual health. Listen to your body's thirst cues and adjust your intake as needed. Next, we'll discuss the role of electrolyte drinks and when they might be helpful. Electrolyte drinks can help replenish minerals lost through sweat, especially after intense exercise or in hot weather. However, many commercial drinks contain added sugars and artificial ingredients. For most people, a balanced diet and regular water intake are sufficient. Use electrolyte drinks selectively and consult your doctor if you have health conditions that affect electrolyte balance. Next, we'll look at natural sources of electrolytes. Natural sources of electrolytes include fruits, vegetables, dairy products, nuts, and seeds. Bananas, oranges, spinach, yogurt, and almonds are particularly rich in potassium and magnesium. Including a variety of these foods in your diet helps maintain electrolyte balance and supports muscle health. Next, we'll discuss the importance of regular meal timing for preventing cramps. Eating regular, balanced meals helps maintain steady blood sugar and nutrient levels, which can reduce the risk of nighttime leg cramps. Skipping meals or eating too late at night may increase the likelihood of cramps. Try to eat at consistent times each day and include a mix of protein, healthy fats, and complex carbohydrates. Next, we'll look at the role of stress and relaxation in muscle health. Stress can contribute to muscle tension and increase the risk of cramps. Practicing relaxation techniques, such as deep breathing, meditation, or gentle yoga, can help reduce stress and promote muscle relaxation. Making time for relaxation each day supports overall health and may decrease the frequency of leg cramps. Next, we'll discuss the importance of sleep quality for muscle recovery. Good sleep is essential for muscle recovery and overall health. Poor sleep quality can increase the risk of cramps and make it harder for your body to repair muscles. Establishing a regular sleep routine, keeping your bedroom cool and dark, and avoiding screens before bed can all improve sleep quality. Next, we'll look at how to track your symptoms and progress over time. Keeping a symptom diary can help you identify patterns and triggers for your leg cramps. Note when cramps occur, their severity, and any changes in diet, activity, or medication. Sharing this information with your healthcare provider can help tailor your prevention plan. Next, we'll discuss the importance of patience and consistency in managing leg cramps. Managing and preventing nighttime leg cramps takes time and consistency. Changes in diet, hydration, and lifestyle may not produce immediate results, but sticking with your prevention plan can lead to gradual improvement. Be patient with yourself and celebrate small victories along the way. Next, we'll provide a quick recap of the most important points covered in this video. To recap, the most important vitamins and minerals for preventing nighttime leg cramps are magnesium, potassium, calcium, and vitamin D. Safe testing and working with a healthcare provider are essential. Lifestyle changes, such as staying hydrated, stretching, and eating a balanced diet, also play a big role. Remember, supplements should only be used when necessary and under medical supervision. Next, we'll share some final thoughts and encouragement. Nighttime leg cramps can be frustrating, but with the right knowledge and approach, they can often be managed or prevented. Focus on a balanced diet, regular hydration, and healthy lifestyle habits. Work with your healthcare provider to identify and address any nutrient deficiencies. Remember, you're not alone. Many people experience leg cramps, and help is available. Next, we'll provide resources for further information and support. If you'd like to learn more about leg cramps, vitamins, and minerals, there are many reputable resources available. Trusted health websites, registered dietitians, and your healthcare provider can offer personalized advice and support. Staying informed empowers you to make the best choices for your health. Next, we'll wrap up with a positive message and encouragement for your wellness journey. Taking charge of your health is a journey, and every step counts. By learning about the role of vitamins and minerals in muscle health, you're already making progress toward fewer nighttime leg cramps and better sleep. Stay consistent with your healthy habits, and don't hesitate to seek help when needed. Wishing you restful nights and strong, healthy muscles. Electrolytes are minerals in your body fluids that carry an electric charge. They include sodium, potassium, calcium, and magnesium. These minerals are essential for muscle contraction, nerve function, and maintaining fluid balance. Imbalances in electrolytes can lead to symptoms like muscle cramps, weakness, and irregular heartbeat. Maintaining proper electrolyte levels through diet and hydration is key for muscle health. A deficiency occurs when your body does not have enough of a specific vitamin or mineral to function properly. Deficiencies can develop gradually and may cause symptoms like muscle cramps, fatigue, and weakness. Testing and identifying deficiencies early allows for targeted treatment and prevention of complications. Maintaining a balanced diet and regular checkups are the best ways to avoid deficiencies.